Are you treating symptoms while the real problem might be hiding in your plasma? So, my guest today is Dr. Mohammed Mansour. He's going to unpack his findings working with patients who have had long COVID, mold, toxic metals, and the overlooked neurological damage that toxins cause as a whole, and how therapeutic plasma exchange may actually be the only intervention that can help reset our immune systems when nothing else is moving the needle. Think of it as that oil change for your body. Dr. Savage has talked about this before, how it helps clear out the auto-antibodies, the forever chemicals, and this toxic load that's keeping millions of people stuck in cycles of fatigue, inflammation, and chronic illness. Dr. Mansour is going to break it all down, and he also has a very step-by-step approach of how he works with patients that I think can also shine a light, help you as well. So let's dive into it. Dr. Mansour, it's great to have you here, man. Thanks for taking the time. How you doing?
Thank you. Likewise, I appreciate it. What you guys are doing.
Thank you. Yeah, we're all doing something that's trying to push the limits here, right? And like stay with the times and be kind of definitely groundbreaking and everything we're doing. And that's what you've been up to, I know, for a bunch of years too. And it feels like we've been chatting. There's all these different new developments just in the last 5-10 years or so. But I guess just quickly give me your background, kind of like your focus, and I'm always curious to learn a little bit about your human side and experience before we jump into some of the topics here.
Yeah, thanks, Joe. I mean, I'm a naturopathic doctor. I'm licensed in California and Arizona. I have a subspecialty in regenerative medicine, in particular using ultrasound guided imagery. I do work with non-autologous regenerative products, so not just like bone marrow or PRP or blood-derived products that are regenerative, but actually from third-party donors, so namely exosome-based care and also placental matrix and other orthobiologics that have exciting potential. And I obviously in the last 5 years, everyone had to get versed in chronic fatigue syndrome, myalgic encephalomyelitis, all the things that hit after COVID. And I think whether you like it or not, you kind of have to get into the world of multiple systemic infectious disease. So that could be Lyme, COVID, viral, could be any one of those. So I definitely have a focus in the world of tick-borne related illness and chronic infections, as well as just how to get rid of those. And a lot of times it can be very persistent. You need creative tools to get rid of that.
Because you said, things have changed a lot in the last, like I said, about 5-6 years or so since like COVID time, I guess. What's your perspective on it? Like, how's it changed from your side? Is it like a different approach that you have to take now, or just new things?
Absolutely. I mean, it's multimodal.
Yeah.
I know there's a lot of direct-to-consumer lab companies hitting up, the algorithms on Instagram and saying, hey, you can just buy this yourself and figure out what's going on with you. Unfortunately, it's not that simple. You have environmental toxins, you have heavy metals, you have mold, you have multiple triggers that can lead to long COVID. That could have just been already simmering in your system. You need a specialist for that. You need somebody who's versed in environmental medicine and chelation, heavy metal toxicity, and also intravenous nutrition, because a lot of people can't absorb things through their gut. They're going to need other ways to get treatment intravenously and bypass the gut, at least initially for some folks. So definitely a multimodal approach is what I found to work best. I don't see silver bullets. Even though I'm a naturopathic doctor, I do love herbal medicine. It's not always enough to really get somebody over the hump. It can definitely help. It definitely can potentiate the effects of certain pharmaceuticals as well. But in and of itself, I haven't found a lot of silver bullets in the post-pandemic era.
I guess walk me through how you define that and kind of what that can curtail,
Yeah, I mean, obviously you want blood work. You want basic understanding of a patient's physiology. You want to understand what their toxic load is, what their body burden is. to mold is a big immunosuppressant. It can make it very difficult to fight infections like COVID, or even have overlap in terms of symptomology with long COVID. Even Bruce Patterson and people who are developing long COVID blood work panels are realizing like, hey, there's a lot of overlap. We need to tease this apart. And so you definitely need a combination of blood work, environmental toxicity panels, urine analysis. Sometimes you need 24-hour urine because a lot of toxins don't get excreted right away. So it's not just about doing these direct-to-consumer kits and you're going to have everything in a snapshot. It's not like that. Your body doesn't work that way. It doesn't eliminate toxins like that. And you need somebody who has a thorough understanding of half-life, understanding how these toxins and potential triggers to infections, viral or mold, etc., are even activated and then sequestered in your body. They could be in your fat tissue, so they're not even going to show up in your blood. And they may not show up after a sauna just because you pee one time. So every one of these toxicants, heavy metals, each one has a story. Each one can tell you something. Perfluorinates can tell you something else, the forever toxins. So it's like you really have to have someone who knows where to test, how to test, and then how long to test for, because you can't always get the answer just from a snapshot. So that's kind of like the short of my approach. The long of it is, well, what do they tolerate? What is the patient actually able to do? And so a lot of times, if they're able to tolerate, minuscule minerals, IVs, maybe they can't tolerate a lot of foods, they have a lot of sensitivities. Those are challenging cases. I might do more neurological based therapies that focus on their vagus nerve, that focus on recalibrating their vascular tone so that they can actually have good perfusion, they're actually awake, they can actually be alert enough to tolerate things and not react. And then you might think of things like laser therapy. So red light is a popular one, but there are many forms of laser therapy that could be effective in the realm of chronic infections, COVID, toxins, not just red light, but blue light, green light. Each one of these wavelengths have a myriad of effects on your mitochondria, the powerhouses of your cell. Different parts of your cell can get activated with different wavelengths. So it's a much more nuanced approach than just like, hey, I'm just going to get this red light pad, stick myself in a cryo chamber and call it good, and I'm going to be optimized. I'm like, not necessarily, not all the time. A lot of people who have a good vitality could get away with that. A lot of people, unfortunately, who are suffering, who have maybe subclinical issues, that doesn't work for them. So you have to have a more nuanced approach.
Dang. Okay. So yeah, getting all the testing is definitely step one, it sounds like. And
Absolutely.
Yeah. And then from there, like you said, because the toxins are telling their own story, I thought that was interesting. So they're all like not only are you going to see a snapshot, and obviously snapshots change, right? Like over time and whatever you're doing to the system as well. But then that's going to tell you kind of more or less what things that you might need to do then, right? Different modalities.
Absolutely. And then, what's the order of intervention for a patient? Like, where can you meet them where they're going to tolerate treatment? So if their elimination pathways, their liver, their digestion, they're not even pooping, you're not going to be able to get very far with a lot of oral therapies until you get that train moving again. So sometimes just opening lymphatics, doing low dose, even homeopathy, energetic based forms of herbal medicine could be potentially effective. But, it really depends on the case, and you kind of have to, you make that clinical decision based on the patient.
That's crazy. Yeah. Is there anything else in your thinking, I guess, on this approach to the multimodal?
The most under talked about issue, I think, in the last few years, it's clear that long COVID, the pandemic, has raised concerns of neuroinflammation, autoimmunity, even increased rates of cancer. The immune system is dysregulated. We can all agree on that. The literature is clear. Your natural killer cells, your Th1, your ability to fight viruses and cancer is definitely compromised. But the other impact of that is the brain and what it's doing to your neurological system and how you're able to perfuse your blood through your body. And that's an autonomic based system. That's on autopilot. And your balance is also on autopilot. That's your cerebellar, your vestibular function. Those parts of your brain are very, very sensitive to toxins like mold or spike protein or viral or EBV or what have you. They're also very sensitive to chemical toxicants like perfluorinates, like VOCs, like, you know, you pick one, you know, of the
So many
thousands that are
chemicals.
out there, benzene, etc. And I think the neurological aspect is definitely underplayed, and sometimes recalibrating that is really important through certain rehab and certain types of evaluation before you can even get them to tolerate anything at all. Sometimes that needs to be done through a specialized neurological approach. It could also be done through an energetic approach. Some people respond well to body work. Some people respond well to what they call amygdala retraining the parts of your brain that sense danger. And that's kind of like a cognitive-based, you know, talk approach to that part of your brain. But it could also entail actual rehab strategies of those pathways to actually recalibrate your balance, recalibrate your body's ability to control blood pressure. And that's a challenge because that's like multidisciplinary. Now you're talking about 6 or 7 different specialties, but you're only looking at one doctor and you're expecting them to know all that. So that's a challenge, is to stay up to date with like how much these issues overlap multiple systems. It's not just like one system that you can focus on. Oh, if I remove spike protein from your blood, you're going to be fine. I'm like, no, your brain gets rewired a certain way, and that needs to be addressed. That might require rehab. It's just like any other organ, and that's a underlooked or, you know, underappreciated point. Because your brain controls your heart rate, it controls your vision, it controls your ability to coordinate, your ability to tolerate certain things. And yeah, it can be something that really needs a deeper dive.
Yeah, I think it's a good point to make, man. And we've had some neuro like retraining folks on the podcast, which has been great. But you're right. It's like once you chill out the nervous system, it at least alleviates the pressure, right, on some of the other organs downstream. So it just makes sense to address that as well in its own way.
And you stated it, like there are many ways to cut the cake. Like it could work for some to do the retraining to calm that part of your brain down, but some might need somatic or body therapy or frequency specific microcurrent or some other modality that kind of addresses that nervous system in a different way. You know, I do more interventional work where you can actually, you know, inject orthobiologics near your cranial nerves and get them to reboot and kind of get them to turn back on. If you have like ringing in your ears, tinnitus, or you have severe dysautonomic issues, a lot of times those cranial nerves get really, really irritated with viral infections or with mold or toxins or inflamed lymph nodes. So there's no one way to do it, and there's no one way that's gonna work for everybody, but acknowledging that it's a focal part of the pathology of this post-pandemic era, I think it's really important.
Totally. Well, I think you're bringing up a good point, and it shows like how new a lot of this thinking is. Because I doubt that's what I'm realizing is like a lot of, you know, this is a source of information. You know, and this podcast just in itself, there's a lot of doctors listening. There's also general public listening, so it's kind of like this interesting. There's just a lot of new stuff, and also it's a lot of layers for an individual doctor to handle, right? Like, I don't know. I guess it's kind of tricky. You have to pick your doctors well, right? Like, so I don't know. Like, do you have any like best practices actually on that before move on into a couple
Best
other things?
practice is always meet the patient where they're at and always understand, you know, obviously there's a financial burden. A lot of patients who see me, they've already been to like 10, 20 other specialists. You know, they've been to, you know, Stanford, they've been to Harvard. They've been to the top CFS, chronic fatigue clinics, and nobody has answers for them. What you need to do is understand that they have treatment fatigue. They have doctor fatigue. And a lot of times just doing one or two simple things that they could tolerate, that's affordable, that could be it for a while. And that's okay. It's not going to get them 100% better. It's not the fix, but that allows you to build that relationship. And I think that's the biggest one I've had to humble myself about, because we all want to help our patients and do everything we can, but less is more is what I've realized. Like, just doing everything up front sometimes overwhelms the patient, and sometimes just stepping back and just picking one or two priorities and being like, hey, let's work on your drainage. Let's work on your balance. Your vestibular tone, you're totally dizzy, like you can't concentrate. Let's focus on that first. Because if you don't know where you are in space, it doesn't matter what I'm putting in your body's always going to feel like it's in danger. So certain things like that, I feel like have humbled me to be like, okay, I think, we have to be simple in certain ways, even though these are complex conditions that we're dealing with.
Makes perfect sense though, man. So yeah, meet them where they're at. What's going to give the biggest impact to continue momentum, however that looks like.
Absolutely. But you never want to stay behind on the science. Like, Aristo Vojdani, who's one of the premier experts in immunobiology, he just released a new long COVID panel. He's the head of Cyrex, which is a pretty famous laboratory. And he also has Immunosciences, his own company. And his lab, we just were on a webinar with him last week, and his panel now has so many more autoantibodies. So these are antibodies that are attacking your brain tissue, your mitochondria, not just EBV or other viruses that are co-infected with long COVID. And these autoantibodies are related to chronic fatigue, multiple sclerosis, a lot of the neuroinflammatory picture of long COVID. And these panels just came out. Like, they're not like, this is something you just constantly have to be updated on and constantly be reading about, because if you're not up to date, you don't know that, I can actually check for this stuff. And if you can get an antibody picture months before symptoms get worse, that could be the difference of saving a patient's quality of life for the next 10 years. Or even recommending, the services that, your company offers through Plasma Exchange, and actually pulling off the plasma portion of your blood that actually harbors a lot of these, autoantibodies that are attacking your brain, attacking your mitochondria, etc.
Hello, my name is Carey Stewart, and I did the brain protocol for the MD Lifespan. I was struggling to recall names of couples, and so I shared this with the doctor. That's when he introduced me and said, I think you're ready. And let me explain to you a TPE, because this is going to help your memory, your focus, your clarity, and I truly believe you'll be a wonderful candidate for this. I have had 5 TPE protocols, and each time I have improved. And it's not until this last one that I am feeling so back on top of my game. Like, my brain fog is gone, I am focused more, I have more clarity. This was life-changing for me, and I feel so much better for it.
It's a lot to keep up with, but it's you got to do it somehow. And there's all sorts of information. But yeah, we're doing our best here. So thanks for helping out.
No, and thank you guys. I mean, Plasma Exchange was a very nebulous procedure. I didn't hear about except in extreme, ICU issues, like, very, very complex autoimmune issues. Not even all PANS and PANDAS children cases were eligible for it. And you couldn't find that anywhere. So you guys are actually trying to provide this along the country. Kudos to you for doing that, because a lot of patients would never have access to it at all.
Yeah, man, it's new, and Dr. Savage and his vision with it all at MD Lifespan, it's pretty awesome. So talk to me about, because you have the EBOO comes up often, and like as it compares to like TPE, Therapeutic Plasma Exchange, like we're talking about. I guess like tell me your perspective because we're talking. I don't know, like when is this apply? I guess like defining it, kind of the scenarios where you see it plays best for patients. Just kind of
Yeah.
putting it out there.
I
Yeah.
mean, EBOO is an acronym. It stands for extracorporeal blood ozonation and oxygenation. That's a mouthful, but basically, it's extracorporeal means taking blood out of your body. It's a two-line system, so you have two IVs. There's an outline and an inline, and then in the middle, there's a filtration system with a pump. The pump is pretty low level. It's pulling the blood out at a pretty reasonable low rate. And it's basically siphoning it through a filter that can trap some uremic toxins. So these are higher molecular weight. This isn't like plasma exchange like what you guys do. This is definitely bigger molecules that can get trapped in this filter. Beta-2 microglobulin is one of them. There's several other uremic-based toxins that can get trapped. Some studies and colleagues have shown that even biofilm can get trapped in it. And at the same time you're filtering the blood, you're ozonating it. So there's actually an ongoing continuous ozonation of the blood. And that's the aspect to EBOO that's a little bit different than other forms of ozone-based therapy. So this is all under the category of ozone. Well, what does ozone do in the body? Well, it can boost your mitochondrial function. It boosts something called oxygen utilization. So the way your body can utilize oxygen and maximize metabolic efficiency is improved with exposure to ozone at the right dose, obviously in the right concentration, in the right administrative ways. And that is a critical piece because of chronic fatigue and chronic infections. You need something to kind of improve that metabolic switch in your cells and obviously in your mitochondria too. The other offshoot that's interesting about of ozone is that it boosts NAD. So that's a hot one. A lot of people are looking for NAD for energy, but ozone actually improves your body's natural ability to make NAD. And that's a critical molecule to improve oxygen utilization, the way your body uses oxygen. If you can't use oxygen efficiently, you're going to be fatigued, especially after exercise. You're not going to get good perfusion into your muscles. It won't matter how much effort you put in, you're never going to get the output you want. And that's what's so devastating about a lot of the viral conditions. So if it's acute viral, let's say it's acute COVID or it's sepsis, acute bacterial, EBOO is fantastic for those acute situations because you're getting high throughput ozone. It's continuous. It's like a timed procedure. And it's also higher surface area of the ozone to your blood because of the filter. So the nice thing about that, it's not like the old school, you pull a little blood out, you mix it with ozone, you kind of reinfuse that back. This is actually being exposed through a filter. The ozone has much more surface area of the blood to be exposed to while it's going back in the inline. So it's much more ozonation of your blood per unit time. And it's also a way to kind of trap biofilm and some of the higher molecular weight toxins that are in your blood. It's not dialysis. A lot of clinics, it's a misnomer, they call it that. It is not formally known as such. And there's a lot of misdirection in terms of, well, you've never done ozone before, so let's just ship you on to EBOO right away. And that can be a disaster. So
Really?
if somebody doesn't have the reserves of antioxidants and ability to tolerate ozone, and they've never done it before, or let's say they have certain genetic traits like a G6PD, certain blood traits that make them intolerant to ozone, that can be very dangerous. So it's not like everybody can just do this. There is a graded scale of how I like to introduce that to a patient. But it can be a game changer for sure. It can definitely, if it's used the right way, it can turn an infection around very quickly. And I'm talking within hours.
Really?
I've
Wow.
had septic patients post-surgical, a botched testicular case. He was going to lose his testicle, literally, and EBOO saved it. Like, it basically turned the
crazy.
sepsis around. So, and the same with acute COVID. Like if you get it in that acute phase, it's money. Like every time. That's why they used it in Africa with Ebola,
Yeah.
because if you can capture it at that early phase when it's still replicating, you're in. Like you can definitely
Interesting.
have a massive impact. Unfortunately, in the chronic cases, once it passes that initial phase of infection, you're definitely going to be more in the lines of using plasmapheresis, using other ways to modulate the immune function, because now you have memory cells, now your immune system has been dysregulated, and now you need to reboot that and modulate that. So it's no longer just about going after the infection anymore. So that's where I find the biggest distinction, and vaccine injury too, between EBOO and when you would use, plasmapheresis.
And that's TPE, right? Yeah, therapeutic
Exactly.
plasma exchange is just multiple
Exactly.
names. Yeah.
Yeah, and I don't find that EBOO can help with. It can help in some phases of acute inflammation with vaccine injury, but I definitely veer towards plasmapheresis TPE for vaccine injury, long COVID, anything that's past kind of like that first initial infectious phase of the first 15 days. You have to start thinking. The one exception I would make is chronic Lyme and chronic tick-borne illness. So Bartonella, because they have persister cells and they make biofilm, you need something to capture that biofilm and at the same time kill active replicating pathogen. And that's where EBOO, I find it turns the lights on really quickly for those patients. Is it a silver bullet? No. Can you just rely on EBOO alone? Absolutely not. But in conjunction with IV therapy, lasers, you can get a lot of headway and make a really good jumpstart in patients' cases when you consider it.
That's interesting. Thanks for laying that out, like kind of the differences and just understanding. It seems like, huge benefits, especially when it's a timely thing going on, like you said, active infection in some kind of time window for EBOO. And yeah, TPE for more of like the long-term stuff, that you just got to rid from the system.
And toxins, that's the
And
big
toxins.
one. Obviously mold is being thrown around like, hey, EBOO's going to get rid of mold. EBOO's going to get rid of, all the spike protein. We have no evidence for that. The technology was originated in Malaysia, and I did train with the initial people who invented EBOO, but unfortunately not everyone is using the right filtration system. They're not using the right filters. They're also potentially using too much ozone, which causes too much oxidative stress. It actually hemolyzes your blood. It breaks down the red blood cells, so that's really bad. And I don't find that it's appropriate in a lot of cases of mold toxicity, because a lot of times they can't even tolerate ozone.
Oh, wow.
And that, some of my mentors like Dr. Neil Nathan and Jill Krista, they've seen the same things like, hey, you have to be very careful with mold sensitive patients, because what does mold do? It's similar to COVID. It's dysregulating your immune function. It's causing this low level inflammation. It's causing a lot of hypersensitivity, mast cell, histamine release. You're super sensitive. You add ozone to that mix, they don't have enough antioxidants. They don't have enough reserve to fight, and their immune system's already compromised. It can backfire. So that's where a lot of people get negative reactions. They get bad experiences because it was used at the wrong time. I don't say that you can't use it, but I don't think it could be used immediately in those types of cases. I definitely would lean towards plasmapheresis, especially with multiple chemical sensitivity, mold, any type of toxins that are very difficult to eliminate, perfluorinates, PFAS, forever chemicals, those types of things. You definitely need something to pull the plasma, the soup where all the cells are living in. You gotta pull some of that out, siphon it off, and allow your immune system to reboot.
Yeah, it's like literally you got to extract it. Talk to me about the IV nutrition that you give, because I think that was a key part. You mentioned it earlier, and because I know that's paired up with TPE sessions. You said it bypasses the gut, so it's kind of like where it really is played. But I guess how do you pair that to a detox therapy like this? Like
It's
EBOO
it can be game changing as well. It can potentiate the effects of ozone. There are certain nutrients, that work in synergy with ozone, like artemisinin or wormwood for short. You can administer those. It's called artesunate for short. In the cancer world, they use it a lot for cancer, but it can be layered with ozone and EBOO because it potentiates those oxidative effects. But again, you have to be careful. It can induce hemolysis, break down red blood cells if you're too aggressive. So it's kind of like this seesaw. It's kind of like a balance. With infections, obviously you can do vitamin C. You can do a myriad of amino acids and nutrients, like taurine is very important to clear certain types of infections like Klebsiella, things that create biofilm. So certain amino acids can definitely be added to IV nutritional therapy, but it's a case by case basis, because a lot of people need to start with just getting antioxidants. Like, hey, you don't have enough vitamin C or B vitamins or magnesium to even tolerate ozone. So we just got to give you some IV nutrition first. And sometimes I just have to do that first for a while, for several weeks or maybe even months if they're extremely depleted and deficient. And then we transition over to ozone later. And a lot of times, as I said, I don't do EBOO right away. I do something like ozonated saline. So that's intravenous. Yep. But instead of giving ozone in this like really advanced system where you pull the blood out, I just ozonate a bag of saline and administer that. And that can be really effective as a gentle way of giving some ozone and just allowing that patient to have that immune regulatory effect, as well as giving them IV nutrition. But I think the biggest ones, obviously, glutathione, vitamin C, B vitamins, amino acids, carnitine, taurine, lysine in certain regards, especially in viral issues. All these can be given intravenously with really good results. Curcumin, now you have some compounders making other types of nutrients, even polyphenols like green tea extract, resveratrol can be given intravenously. They have their place, but you have to see what's the inflammatory load. Are they even is it like just throwing water into a wildfire, or am I just trying to build them up slowly, give them what they need so that wildfire can get contained again? So again, that's where it's a great modality. It has 100% bioavailability, but I can't use it on its own a lot of times. What I'd like to say, in addition to IV therapy, you can potentiate the effects of IVs by doing laser therapy. And I don't think a lot of people realize there are ways to layer fiber optic lasers intravenously on top of IV therapy. That's called the Weber system, which not a lot of people are well versed in, but it can address biofilm. It can activate certain B vitamins, like riboflavin is activated by UV light, and that kills COVID on contact. That's immediate. Like you can spray some riboflavin in your nose and express UV light and expose your nostrils to UV light, and it'll kill the COVID right away. That's been documented. And even double envelope viruses in general. So that applies to flu, etc. So using laser as an activator of IV therapy, I think that's also underutilized, underappreciated. So it's not just it's not just one thing, but if you look at it like a symphony and everybody's playing their part, hey, don't forget about the cello, don't forget about the oboe, don't forget about the brass section. These people, when they come together, it sounds amazing. Everyone in particular sounds great, but when you put them together, it's a different story.
It's kind of a good way to end this, because like you're talking about just like the slew of how layered this stuff is. I mean, the human body, obviously it's not straightforward, but it's like you got to be well versed, have the right doctor that you're going to, of course, and just ask questions and just make sure that you're going to get the treatment that's best for you. Hey, where can folks go chase after you, go dive into a little bit of what you're doing if they want to go find you?
I mean, my website has a lot of info. It's mansourmedical.com, MANSOUR medical.com. I'm not that active on Instagram, but you could find me there. It's dr.mansour_ND as a naturopathic doctor. And yeah, I try to post some things that are relevant. I have some promising research that I think your team would like to know about musculoskeletal injuries in the sports world related to COVID, because that translates to what you guys are doing on the plasmapheresis front. There's a lot of correlations that I think will be really, really exciting to make with your technology and your services, even with cancer and plasmapheresis. And I'm really excited to see what you guys do with that.
Nice, man. Well, yeah, we'll definitely make sure you're synced up with everyone there. But yeah, go definitely. We'll link out everything in the show notes, description, and all that stuff, so it's easy. Dr. Mansour, thank you, man. You brought in all interesting perspectives. It's always
I appreciate you. No,
Yeah,
thank
man.
you for the platform, and I'm excited. And we just got to keep it going, get more people aware of it. I'm excited.
That's right. We're all that's everybody's game right now. It's more awareness.
And just
So,
understanding that you can't always detox things. Like sometimes you do need plasmapheresis, like PFAS and chemicals. You can't always sweat that out. You do, unfortunately, we live in a world where we do need these technologies. So that's important to get out there.
Yeah, it's good that they're here, though, man. But well, keep doing what you're doing, and keep sharing the notes too. This is helpful. So
For sure. Thank
all right,
you.
man.
Appreciate
Thank you.
you.